Why your hand still hurts after a wrist fracture is not that complex, but not that many people talk about it. So I'm going to share with you my perspective and what I see in my patients when I work with them. My name is Huang. I'm an occupational therapist and certified hand therapist, and I help people with hand and arm injuries in my clinic, and I also teach to other therapists. So one of the things that happens, and I got this question from somebody who read one of my articles on my website, and he was telling me that his hand was still hurting after a wrist fracture. Now, just because you didn't have to have surgery or you did have to have surgery, it really doesn't matter. You still broke it, and now something has happened to your whole arm that's making it still like, why is it still hurt? I'm going to share with you some of the things I want you to kind of keep an eye on and fix, right? I'm going to share with you some things that you can do to fix it, because all hand pain is not the same hand pain. So if you fell and you broke your wrist, right? Here is the distal radius fracture here. So it's this bone, and it's funny because I got the question from a doctor, and so he had the understanding of this is a non-displaced fracture. So if you see that on your script or your doctor tells you a non-displaced fracture, just means it broke but it stayed still together, right? So people who have a displaced fracture means it broke and it moved and it shifted a certain way, maybe there's some twisting, and usually with those types of fractures you have to have surgery. So then you have an incision here, you have a plate and some screws. That is called an open reduction internal fixation. So open, they opened you up. Reduction, they put all the pieces together, and internal fixation means plates and screws on the inside. They close it up. Now you're stable. We wait a certain amount of time for bone healing. Even in that time that we're waiting, you can still do therapy and you can still move. There's a lot of things for you to still do. But I'm going to talk about specifically why it still hurts after 3 months. If you want to watch some of the other videos of like, what do you do at the beginning and things like that, I have other videos. But what do you do now, even though it's been 3 months or more and you still have hand pain? So let's talk about the different types of hand pain. So you can have hand pain in your palm, you can have hand pain on the back of your hand, and you can have hand pain kind of more related to the thumb. So those are the three various chunks that I would call it of why your hand still hurts. So number one, if you still have hand pain, that's kind of just in your palm, there's a couple of things. In our hand, in our wrist, your muscles have to be balanced out. We have big, long muscles that start in our elbow, cross our wrist, and they're the ones that move our fingers, right? Now, we have small muscles in our hand. Those are called intrinsic muscles, and those little muscles start in our hand and end in our hand. And there has to be a balance between those groups of muscles. If you lose the balance of it, your hand can still hurt. Even though you have a wrist fracture, your therapist might be like, well, your doctor says that your surgery looks really good. And then your surgeon's like, well, I did the surgery and everything about the surgery looks amazing. And you're like, I know, but my shit still hurts. You might have what's called intrinsic muscle tightness. That's what I call it, because that's the group of muscles that are really, really tight. Now, if you've been sitting here and you've been squeezing a ball, you're just squeezing that ball because you're like, I want to get stronger. That might be making you have very tight intrinsics. So compared to this muscle, to these other muscles, they're a little wonky. They're out of balance. And you have intrinsic tightness. So in order to get rid of that pain, you have to be able to go like this. This is called a hook fist, right? So everyone thinks about making a fist, like making a full fist. So sometimes you can make a full fist, but if you cannot make what's called a hook fist, that means these muscles inside your hand are really tight. So how do you make a hook fist? Keep your big knuckles straight, curl your little knuckles in. You see how tight you can go? So how do you know, like, am I supposed to make my hand do what Huang's hand is doing? Well, you compare it to your other hand. So if your uninjured hand can do it, or however far it can go, that's what your injured hand is supposed to be able to do. And people who are very tight right here have a very hard time keeping their big knuckles straight. Here's your big knuckles, your middle knuckles, and your little knuckles, right? And so your big knuckles need to stay straight. Bend your middle knuckle and bend your little knuckles. This is called a hook fist. If you cannot do this, this is the one exercise to do. You're going to clasp your hand, Put your fingers in between your other fingers. What this does is it separates the bones, it stretches out the muscles, right? Just relax. You don't have to be overly aggressive, okay? Every time I teach this, all my patients get really aggressive with it. And I always tell them, when you're injured, I know you're trying so hard that you kind of overdo it and then you don't do it correctly. So just kind of half-ass it, right? So hands in between, right? You're going to hold the big knuckles straight with your uninjured hand, and then all you're going to do is curl your little knuckles up and down. Everyone thinks that making a fist is the most important, but you cannot make a fist unless you can also open the fist, right? So I always focus my patients on opening their fingers. So open it wide, curl it down, open it wide, curl it down. 10 reps, lots of them. Number 2, if you have pain on the back of your hand, now it might not just be pain, but there might be a little bit of numbness to it. If you have a little bit of numbness, then that usually indicates anytime there is a sensory change, meaning there's a little numbness, there's a little, like I touch this and I touch that. It's not necessarily painful, but it just feels different. That is nerve tension. And so when you have a wrist fracture, whether you have surgery or don't have surgery, sometimes the casting can be a little tight, and we have a little nerve that runs here. 3 nerves, but one of them that runs back here, it's called the radial nerve, right? And it runs right by our elbow, and then it runs right by our thumb. So if you had a cast on that was a little too tight, if you had a splint on that was a little too tight, or just because you got really swollen because you fell and you broke your wrist, sometimes that happens, and you get a little bit scarring and it's snagging that nerve. And that nerve can cause kind of like irritation right on the back of the hand, right on the thumb. If it's on the back of the hand, I would Huang here, because I've seen it multiple times, would suspect that it's coming up here. So if you're working with a therapist, definitely talk to them about working a little bit more to the elbow and the shoulder. This is what I do with my patients. So go talk to your therapist. If they're not doing it, then you can call my office. If you're in Miami, I'm here in Miami. If you're not here in Miami, you can still call my office and see how you can work with us, right? So definitely don't think just the hand, because if it's on the back, you've got some nerve issues, and we want to fix that in order to get rid of all of that numbness and weird sensation that you have in the back of your hand. Now, the third and last thing is your thumb. I get a lot of people after wrist fractures tell me how their thumb continues to hurt. Like, why does it keep hurting right here? There's 2 different things, right, why your thumb can hurt right here. Well, your nerve, your median nerve, another nerve comes and it runs, and it can cause you to have carpal tunnel syndrome, causes thumb pain. But you don't have carpal tunnel syndrome unless you also have some other symptoms, right? Such as numbness and tingling and stuff like that. So a lot of times when people tell me it's just my thumb hurts every time I grip and stuff like that, I would encourage you to look. You might not have as much motion as you think you have. So when you have a fracture, you need to have, or you would want to have, as full of a range of motion as you can possibly recover, so that it's even other hand, right? So whatever motion you have. So look at your hands, right? Look at your hands. So you're gonna bring your wrist all the way back, including your thumb. Don't forget your wrist and include your thumb. And it should, for the most part, look even. Pay attention to where your elbows are, okay? Pay attention to where your elbows are. I like to do this on a table so you can support it, but I'm trying to show you I'm trying to show you so I don't have that support. But if you can, plop your elbow on the table, and then you can see, because if you do it and you don't have support, your shoulder's going to move. But you want to see, and then you want to see that you have the same amount of motion on your wrist and your thumb, like evenly, right, between the 2. If you don't have it, you're missing range of motion. And if you're missing range of motion, you can continue to have thumb pain. And the interesting thing about the thumb, it's not always the first thing that I work on, but it's definitely the last thing that I work on, is we have this tendon that helps to pull our thumb down and across our palm. And this is a long tendon. It actually starts all the way down in your forearm, crosses your wrist, and makes a turn into your thumb. And this is the thumb, this is a tendon that bends the tip of your thumb, right? Because it crosses your wrist, if you don't have enough wrist motion and also thumb motion, you can continue to have thumb pain. So if you're wondering, why does my hand still hurt after a wrist fracture? It's a little bit more complex than, Huang, show me that one exercise I can do. It just depends on why you have thumb pain or why you have hand pain or why does the back of your hand hurt. And there's reasons for it. You just have to find a therapist who's willing to take a look and say, why do you have that pain, right? Now, I know a lot of times people try to do their own things on the internet, and that's okay. This is why I make videos like this, so I can at least show you some of the things to do. But at the end of the day, if you're not getting results, really find a trusted therapist in your area. There can be an occupational therapist, a certified hand therapist, but there's someone who can really help you to figure out what's going on and then work to get rid of it, like for good. So you're not sitting here and wondering what the hell is wrong with it. Let me share with you one thing to do for your thumb. So you want to prop your elbow on a table because you don't want to move it, right? You want to bring that wrist all the way back. And then keeping that wrist all the way back, you want to stretch that thumb, right? And this might be one of the hardest things to do because as you pull your thumb back, your wrist is going to, if it's real tight, it's going to pull forward. And you might be pulling at these joints a little bit not as correctly. And so you can cause yourself to have more thumb pain, right? So what I like to do is I like to put my palm on top, my uninjured hand on top, so that I can keep that wrist down. And then I'm going to put my thumb on the back of this middle knuckle, and then I'm going to use my fingers, my index finger, to push on the tip of my thumb, and that way I can move my wrist and I can move my thumb. If you feel that shit all the way down here, that means that your flexor pollicis longus is a little bit on the tight side, and that might be why you have thumb pain. So anyway, if you're wondering why your hand still hurts after a wrist fracture, these are 3 simple things. It's not that complex, but it can be hard to find if people are just putting you through a cookie cutter program. That's pretty much it. So there's always something you can try and do. Go find it. And if you need me, my name is Huang. I'm in Miami, Florida. And leave me more comments and questions below because that's how I'm making these videos for you.